Welcome to DSQ News. My name is Benjamin and we will be reporting the news to you today. Everyone is talking about the coronavirus, also known as COVID-19. But what is COVID-19 and how does it affect people with Down syndrome? There is lots and lots of information out there at the moment. So much information, it'll make your head spin. But it is important to get trustworthy news from places such as the Australian Department of Health or the World Health Organization. So, without further ado, what is COVID-19? COVID-19 is a new virus which is very similar to the flu or the cold. It was first reported last year in December from a city in China called Wuhan. The virus can spread from one person to another in many different ways. Being in close contact with someone who may have COVID-19 through droplets in the air when someone sneezes or someone coughs. Touching things that have cough or sneeze droplets from someone who has COVID-19 and then touches their face. We also have Lizzie, one of our reporters, joining us live from the Gold Coast. Thanks for joining us, Lizzie.
Thanks, Benjamin.
Now tell us, Lizzie, what are the symptoms of COVID-19 and how do you know you have it?
When people get COVID-19, they can show flu-like symptoms such as coughing, a sore throat, feeling really tired, fever, and may also have trouble breathing. Some people will recover easily and others may get very sick and need to go to hospital. If you are sick with flu-like symptoms like the ones we just mentioned and worry that you may have COVID-19, it is important for you to stay at home. Give your doctor a call and speak to them about how they can help you and also check to see whether you may have COVID-19.
How does COVID-19 affect people with Down syndrome?
COVID-19 can affect people of all ages and from many parts of the world, which is why they use the word pandemic. But there are particular people that may be more likely to get this virus than others. People with Down syndrome is one of those groups where they may be more likely to get COVID-19, especially if they are over the age of 60, are very young children and babies, have certain heart problems, have lung disease or respiratory difficulties, which means they have problems with their lungs or breathing such as asthma and sleep apnea, have lower immune function, which means their body finds it hard to fight infections, have leukemia or cancer, or have diabetes.
So, Lizzie, is there anything that we can do to protect ourselves or others from COVID-19?
Unfortunately, there is no vaccine or medicine for COVID-19 at the moment, but there are scientists who are working very hard to make one available. In the meantime, there are things that we can all be doing to stop ourselves from getting the virus and to stop the spread of COVID-19. These things are social distancing. This just means that we are having less face-to-face contact with other people. Always make sure to stay 2 big steps away from others. The government have also told us that we need to self-isolate. This just means that you need to stay at home, particularly if you are sick. Staying away from big crowds or people that are sick, and not shaking hands, hugging, or kissing other people. This might include your close family and friends too.
Some things you can be doing, Lizzie, are not touching your face, especially your mouth, or your nose, or your eyes. Washing your hands with warm, soapy water, especially before you eat, but most definitely after and even before you use the toilet. If you're out in public and you can't access a bathroom to wash your hands, then you can use hand sanitizer gel to clean your hands, especially after touching shopping trolleys and baskets and using door handles, pressing elevator keys, or things that heaps of people touch hundreds of times throughout the day. You can wear a mask if you have a cough or if you have a runny nose. See, if I was wearing a mask, that would have protected everyone around me when I sneezed or when I coughed, because my mouth and my nose would have been covered. If you have visitors or support workers come visit you at home, please make sure that they wash their hands, and also if they are sick, please tell them to stay home. Or if you are sick, please tell them that you are sick and you cannot have any visitors or support workers at this time.
Oh, sorry. That's right, Benjamin. All of these things can protect us from getting sick from COVID-19.
Thanks for the live update, Lizzie. If you would like more information on COVID-19, check out Down Syndrome Australia website on www.downsyndrome.org.au/resources/coronavirus. And that's all from us today. My name is Benjamin, and we'll see you for the next episode of DSQ News. Yeah, DSQ News. Let me think about or not. Okay, remember to wash your hands. Bye.
Information provided in this report has been sourced from the following resources. For more information, we are still open to assist you. Please give our office a call on 3356 6655. Alternatively, you can email office@downsyndromequeensland.org.au.